I am Dr. Mohammad Abubaker, consultant physician, TX Hospital, Kachiguda and TX Hospital, Banjara Hills. I would like to tell you in brief about the management of diabetes in pregnancy or gestational diabetes. In Hyderabad, as you know, Hyderabad is the diabetes capital of the world. So, gestational diabetes is also increasing here, and the causes of gestational diabetes could be late onset of marriage. Generally, the marriage age previously was around 18 to 21 years, but now it has gone up to 25 or plus. So once the marriage is 26, 27 years age done, then if the girl conceives after the marriage, of the age of the girl is around 28, 29, she is likely to develop gestational diabetes. What is gestational diabetes? Diabetes coming during pregnancy is known as gestational diabetes. This is different from the conventional or routine diabetes or type 2 diabetes, which come across even the males or females at any age they can get it. So gestational diabetes, the causes are elderly or after the age of 25 if they are conceiving, or if the age of the patient is more than 28 years, there are chances of gestational diabetes. And obesity is also one of the contributing factor for developing gestational diabetes. Wherever there is a family history of diabetes, there also gestational diabetes chances are more. And physical inactivity, if the patient is a primi gravida, once she conceives, for the first 3 to 4 months they will not be physically active. So lack of physical activity also can lead to gestational diabetes. And coming to the criteria, what is the criteria for gestational diabetes? Normal subjects, the criteria for diagnosing diabetes is fasting should be more than 126 milligram of blood glucose, and post lunch blood glucose should be more than 180 milligram, and random blood glucose should be more than 200. So any of these three readings if you take, and if they are abnormal, it is known as diabetes. In gestational diabetes, fasting, if it is anything above 92, is known as gestational diabetes. If post lunch blood sugar, if it is more than 140, it is known as gestational diabetes. The other criteria for diagnosing gestational diabetes is we do glucose challenge test, that we just ask the patient to drink 100 grams of glucose with a glass of water and take the blood samples. If any blood sample or after 1.5 or 2 hours it is coming more than 140, it is gestational diabetes. And we do glucose tolerance test. So that can be done in a diagnostic setup testing, and we take the fasting sample, then post lunch samples every half an hour, then take the reading. Any of these readings, or any blood glucose more than 140 after 2 hours, we considered it as gestational diabetes. So coming to the treatment for gestational, of course there are no symptoms, patient will be apparently normal. If the patient goes to the gynecologist or obstetricians during routine screening, it is detected gestational diabetes, generally at the 5th month of pregnancy. So if the sugars are persistently high, there may be growth retardation, or there are chances of fetal abnormalities, congenital malformations, or so many other complications are there with gestational diabetes. Nothing will happen to the mother because the sugars is directly being supplied to the fetus. So you have to treatment is necessary. There is no dietary modification or anything during gestational diabetes. Of course, in some countries metformin is given, even in India also metformin is given, but better to start with insulin. Depends on the blood glucose values and insulin dosage, and number of shots what the patient should get it can be decided by the treating doctor. Generally, we can give 2 times daily insulin with a minimal dose of 4 to 5 units in the morning and 4 to 5 units in the evening, or 0.1 to 0.2 units per kg body weight. It all depends, because if the body weight is more, the insulin resistance will be there and the patient may require more insulin. So physical activity also helps in controlling the blood glucose in gestational diabetes.